Imagine you're on a long flight, sitting for hours without moving much. You finally stand up, and suddenly your leg feels swollen, warm, and painful. You might think it's just stiffness, but what if it's something much more serious? What if it's a deep vein thrombosis, a potentially life-threatening condition? Let's dive into what DVT is, why it happens, and how to prevent it. Deep vein thrombosis, or DVT, is the formation of a blood clot in the deep veins, usually in the legs. This condition is dangerous because the clot can break loose and travel to the lungs, causing a pulmonary embolism, a life-threatening emergency. DVT doesn't just happen randomly, it's usually triggered by one or more of the following factors known as the Virchow triad. First, vascular endothelial damage. Any injury to the blood vessels, like surgery or trauma, can lead to clot formation. Second, venous stasis. This happens when blood flow slows down due to immobility, such as long flights, hospital stays, or paralysis. Third, hypercoagulability. It's a condition where the blood is more likely to clot, often seen in pregnancy, cancer, or genetic clotting disorders. Other risk factors include smoking, obesity, birth control pills, and recent surgery. DVT often presents with subtle symptoms, making it difficult to diagnose early. Look out for swelling in one leg, especially the calf, warmth and redness over the affected area, pain or tenderness, often worsening when standing or walking. In severe cases, you might see a bluish discoloration of the skin. If these symptoms appear suddenly, seek medical attention immediately. Doctors use a combination of clinical assessment and tests to confirm DVT. The Wells criteria is a scoring system that helps determine the likelihood of DVT. The D-dimer test is a blood test that checks for clot-related proteins. If negative, DVT is unlikely. Venous ultrasound is the gold standard test, where sound waves check for non-compressible veins, a key sign of a clot. If diagnosed with DVT, treatment is urgent to prevent complications. First, anticoagulation or blood thinners are the first-line treatment. Medications like heparin or enoxaparin are given as injections, while warfarin or direct oral anticoagulants are used for long-term prevention. In severe cases, clot-dissolving drugs or surgical removal might be necessary. Wearing compression stockings can help reduce swelling and prevent post-thrombotic syndrome. DVT can often be prevented with simple lifestyle changes. Move frequently. If traveling long distances, stand up, stretch, and move every 1 to 2 hours. Stay hydrated. Drink plenty of fluids to keep the blood from thickening. Wear compression stockings, especially during long flights or after surgery. Consider medications if you're at high risk. Your doctor may prescribe blood thinners as a preventive measure. DVT is a serious but preventable condition. Knowing the symptoms and risk factors can help save lives. If you ever notice unexplained leg pain, swelling, or warmth, don't ignore it. Get checked immediately. Stay informed, stay safe, and take care of your veins.